Hey, everybody. In this podcast, we're going to be talking about vitamin D. The question here is, does vitamin D suppress your immune system? It's a question that most people don't ask because when they think of vitamin D, they think of something that supports their immune system and they think of something that supports their bones. But we're going to talk a little bit about some things related to vitamin D that you may not know. So when most people think of vitamin D, like I said, they think mostly of all the ways it helps to support bones and reduce your chances of getting diseases and getting sick. In fact, there's really solid research that shows that people low in vitamin D can have significant protection from upper respiratory infections like the flu, which is super pertinent this time of year. A 2017 study published in the British Medical Journal pulled data from over 25 different studies from more than 10,000 participants and showed that people lowest in vitamin D levels saw the risk of upper respiratory infections reduced by 50% with daily or weekly vitamin D supplementation. Now, what's interesting in this study is that they compared it to people that get a bolus vitamin D. So that's one really large dose, maybe once a month, or maybe one really large dose that might last them, let's say, 3 months. And there was no benefit in reduction of upper respiratory infections with bolus doses. It only came for people that were taking daily doses or people that were taking weekly doses. And there was some speculation that the authors had about this phenomenon regarding the ability of vitamin D to be circulating in the blood at regular levels rather than to have a really big peak. The reason why vitamin D can be given in these different ways is because it's a fat-soluble vitamin. So your body stores it. It's kind of odd for people to get an option from a doctor to say, okay, well, you could take, let's say, 5,000 IUs every day, or you could take a 50,000 IU capsule once a week. The effects of those are about the same according to the study. I tend to prefer daily dosing to keep blood levels very consistent, but because it's a fat-soluble vitamin, vitamin D will build up in the fat, and that will allow you to store it and release it as needed. Now, let's get back to the study. Even those with normal levels of vitamin D, even if their levels were normal at baseline, and the low levels were defined as 25 or less on blood testing. So I would say on average, most people that I see, probably about 70% of them are below the 25 mark on blood tests. I would say there's, a percentage of people that hang in the low end of the cutoff range is at about 32. I would say a lot of people hang at around 30, 29, 28. Some people are as low as 11 or 12. It's very rare, though, that I see somebody who's not supplementing that has normal levels, 17, 18. So I would say probably about 75% of the people that I see would fall into this category of getting a 50% reduction in upper respiratory infections, and that's colds and things like the flu, if they were to take vitamin D on a regular basis. But even somebody that had normal vitamin D levels at baseline saw about a 10% decreased risk of upper respiratory infections with weekly or daily vitamin D supplementation. Now, let's compare it to something really interesting, because the CDC says that a well-matched flu vaccine for a given flu season confers anywhere from about a 40 to 60% risk reduction for contracting the flu. So if you know your vitamin D status prior to getting the flu shot and your level is, let's say, below that 25 nanograms per microliter mark that we see on blood tests, and you started with daily vitamin D supplementation, your risk of reducing upper respiratory infections like the flu is cut in half. The flu shot, at best, confers 40 to 60% protection. So in people that are deficient, vitamin D supplementation could effectively be said to be more effective than the flu shot in some scenarios. Now, if you fall into that percentage where it's a 60% reduced risk of the flu, the data on the vitamin D doesn't quite compare to that. But it's still relevant and it's still something to consider. And listen, there's no problem with doing both. Just because you get a flu shot doesn't mean that you're not going to get a cold or a sinus infection or some other upper respiratory issue. Or just because you get a flu shot, that flu shot may not protect against the predominant strain, which is what's going on right now in the 2019-2020 flu season. The influenza type A strain is going absolutely crazy. And while there was some protection in the vaccine, it sort of missed it. Flu rates are the highest they've been this time of the year in this area in a very long time because the vaccine actually didn't confer protection. the people that develop the vaccine have to guess based on epidemiological data and history about what viruses and what flu viruses are most likely to emerge in the coming season. Once the flu virus is starting to spread, they can't retroactively go back and re-engineer the vaccine. Once the vaccine is produced, these manufacturers have these contracts and they have to produce a massive amount of it. And it's got to be ready before the flu season to be delivered. Usually, sometimes recommendations is to start flu shot somewhere in October. So that's before they really know what the emerging strain is going to be. So in some years, the flu vaccine is as little effective, even below 40%. So vitamin D supplementation, and this is a large study. It was 25 different studies, more than 10,000 participants, and the results were pretty consistent. So, back to this discussion. Some research has alluded to the idea also that flu and cold viruses are more active in the winter because the reduced sunlight of winter results in lower blood levels of vitamin D. So that's a whole nother theory that I've written some blogs on before that I can link to that talk about this idea that this theory that flu and cold viruses are so predominant in the winter months because we have less exposure to sunlight and our blood levels of vitamin D are significantly less. So if we can keep up with supplementation during these critical seasonal periods when our vitamin D levels tend to tank, we may significantly be able to reduce the spread of some of these really predominant and very dangerous upper respiratory infections. People are understandably incredibly concerned about the coronavirus. It's an emerging epidemic, and we don't know, even though if you really look at the data, the coronavirus is not causing incredibly deadly disease. Its rate of mortality is actually quite low. A lot of people experience symptoms just like the cold, but viruses can adapt incredibly quickly. And the fear is that a new emerging virus that we don't know how to control, if it continues to spread, that its virulence and its ability to cause significant harm will exponentially increase. And if we still can't control it, it's a big problem. We don't know anything about it. Flu viruses have been around for a very long time, but the reality is in this 2019-2020 season, unless for some reason the coronavirus morphs and starts to become more dangerous in causing respiratory issues and more deadly, the flu virus is much more likely to cause far more worldwide deaths than the coronavirus, as it does annually. It's just not as publicized because nobody reads any headlines about the flu, but the coronavirus is this emerging epidemic, and it's very frightening because we can't predict what it's going to do. So realistically so, epidemiologists and researchers and medical professionals are taking a huge amount of precautions in trying to control this virus so that it doesn't have the chance to turn into something that could be very dangerous and very deadly. The SARS virus that was in China, I think it was about a decade ago, that one had a much higher mortality rate. It didn't spread as fast, but it was a lot more dangerous. So, we don't know if the coronavirus can turn into something like that. And the reality is none of us want to find out. But, just to give it some perspective. It's also been noted that people with higher blood levels of vitamin D also have lower rates of many different kinds of diseases, including cancer and autoimmune disease. So the title of this podcast really should be, Does Vitamin D Suppress Your Immune System? That's the hook to get you all interested, because when everybody thinks of vitamin D, they don't think of a suppressed immune system. They think of a super activated immune system. So I want to teach you something new about vitamin D that you never knew, that actually some of its most effective strategies for helping your body have to do with its ability to suppress the immune system. Well, how is it possible that something so good for you could suppress your immune system? So it would seem that vitamin D, in fact, boosts immune function if it helps reduce the risk of things like cancer, right, which is very clear in the data, and flu, and upper respiratory infections, which we just talked about. However, not all things are exactly as they appear, and some of vitamin D's most important benefits have to do with suppressing certain immune functions, not turning them on. An overactive immune system can cause a lot of health problems. A prime example is autoimmune disease. This is a condition in which the immune system has mistakenly identified a part of the body as a foreign invader and begins to mount an attack as if it was something like a virus or a bacteria. Except since it's part of our body, it's never going away like a virus or a bacteria would. And as a result, the immune attack persists for years on end, resulting in tissue damage, inflammation, and certainly end-stage disease. So, some of the most compelling health benefits associated with vitamin D in the literature are related to the management of autoimmune disease. In fact, it's now a well-accepted practice among doctors who manage autoimmune diseases. So that might be a rheumatologist managing rheumatoid arthritis, or a gastroenterologist managing Crohn's disease or ulcerative colitis, or a neurologist managing multiple sclerosis, to optimize blood levels of vitamin D by testing the levels and suggesting doses of vitamin D supplements necessary to raise the blood levels to these kind of idea areas. And different researchers and different doctors and different studies have come to some different conclusions about what they think the ideal blood level of vitamin D is. We know that frank deficiency is like 32 or less. That's what all the blood labs, point out. Doctors speculate on what is ideal. So some people say it should be around 50, 55. I would say that the general consensus that I've seen in the literature and listening to other doctors that have studied the literature is a blood level of vitamin D somewhere around 65 nanograms per deciliter is the ideal. That's sort of, if you get a vitamin D blood test, that's what it's going to be measuring. And the number that you want to hit is about 65. In some people with autoimmune diseases, doctors like to push it a little bit higher. Now, if vitamin D levels get too high, it can create a little bit of a problem because vitamin D regulates calcium absorption. And so you don't want to overdose on vitamin D. That's the problem with this one nutrient versus some other nutrients like vitamin C. People hear it's good for your immune system, it's good for this, it's good for that. And there's a lot of people out there that have kind of a more is better attitude. So they'll go ahead and just say, if one pill of vitamin C, 1,000 milligrams is good for me, I'm just going to take 6 a day or 7 a day or 10 a day if I'm feeling sick. The good news about that is that the only bad side effect you're going to have from taking too much vitamin C is some diarrhea. And it's not life-threatening and it resolves very quickly. It's a water-soluble nutrient, so it doesn't store up in the body. Vitamin D, conversely, is a fat-soluble vitamin, so it will store up in the body, and you don't want to get levels too high. Now, there's very few recorded cases in the literature of people that have gotten hurt or had problems as a result of hold on. What do you want? I'm recording the podcast. Can you please chill out? Very few cases in the recorded literature of people actually having a significant medical issue from taking too much vitamin D, but there is a theoretical problem, and I would say it's important to consider. Because vitamin D, as I was saying, regulates calcium levels, if your vitamin D levels get too high, it can disrupt the calcium regulation and the calcium balance in your blood. Now, this is incredibly important because calcium is this incredibly important mineral in our bloodstream. Yes, everybody thinks about it for bone. That's why they think vitamin D for bone, because vitamin D helps with calcium absorption. But bone is not the reason why too much vitamin D can be a problem. Calcium is one of the most important minerals for regulating these calcium ion or calcium sodium pumps that are on our cell membranes. And maintaining this calcium and sodium gradient from one side of the cell membrane to the other is a key factor in electrical signaling of the body. So disruptions in calcium can be very problematic for the electrical systems of our body. And the most easily affected electrical system in our body is the heart. The contraction of the heart is coordinated by a very sophisticated wave of electrical signals that cause contraction of the muscle for the pumping of the heart. And we are incredibly dependent on a very, very precise mechanism of electrical conduction that is regulated by calcium and these calcium ion pumps in the cell membrane all over the body, but particularly in the heart. So too much vitamin D theoretically can cause calcium disruptions when the concern is cardiac arrhythmias. And that is a huge concern because we never want to do anything to mess with the regularity of the heart rhythm. So this is why it's important to have your levels checked. And if you start supplementation, to have your levels rechecked after you've been supplementing for about 4 to 6 weeks to make sure that the levels are accurate or that the levels are right for your body. Now, the nice thing about it is that these blood tests are incredibly inexpensive, and 99.9% of the time are covered by just about any insurance plan. So a simple order, and you can order them online. You can come into a clinic like mine. You can get a vitamin D blood test, find out where your levels are, start supplementation, and then recheck it about 4 to 6 weeks later to make sure that you're hitting that target range. Somewhere I would say between 45 to 65 is going to be the sweet spot based on most of the research that we've seen. So even these doctors that deal with the most severe types of autoimmune diseases that we can diagnose today, it's a well-accepted practice to optimize blood levels of vitamin D. So, I mean, there's like no debate in the literature about how important this is for autoimmune disease. So why is vitamin D so important in autoimmune disease? We know that it helps sort of ramp up our immune system. It must if it's helping to ward off cancer, and it must if it's helping to reduce the risk of upper respiratory infections like the flu. But why does it have to do with autoimmune disease? Well, to understand this, you have to think of vitamin D not as something that suppresses the immune system, but as something that regulates the immune system. So even this powerful disease-fighting component of our body, the immune system, needs to be reined in sometimes when it becomes overzealous, which it seems like is exactly what vitamin D does. It has the ability to allow the immune system to be strong and active, but without being overactive. Now, this is a critical differentiating point when compared to, let's say, pharmaceutical medications that can only either suppress or enhance a biological process without that key component of modulation or regulating activity. So, for example, giving a drug to suppress the immune system as a treatment for an autoimmune disease will increase a person's risk of developing other infections an otherwise normal immune system can often withstand. And you'll see that on these commercials that advertise these drugs for some of these very difficult to treat autoimmune conditions. They fall under a category of biologic medications, and they're very effective at suppressing the immune system and shutting down the pathways that are driving the autoimmune disease, which significantly helps people suffering with these conditions. But the problem is that the activity of it is not just localized to that arm of the immune system that's causing the autoimmune disease. It shuts down the whole immune system as a whole. So people are more at risk for developing cancer. It's right on the pharmaceutical warning label, and it's right in the commercial advertisements on TV. They're more likely of developing infections like tuberculosis that are difficult to treat and other infections that could be life-threatening. So yes, they work to manage the disease, but the overall side effects and implications can be quite severe. So it's important to try and work every other angle possible to minimize the need for these drugs, or in some cases to actually not have to use these drugs if a case can be managed without it. Now, even with that, vitamin D would still be helpful for an autoimmune disease, even if somebody had to turn to a biologic medication. So, conversely, vitamin D can both downregulate certain pathways in an overactive immune response associated with autoimmune disease, while amazingly at the same time preserving and sometimes enhancing the activity of the arm of the immune system responsible for destroying viruses, bacteria, and even cancer cells. It's an amazing feat only attainable by using therapies that work in accordance to the natural biological laws of our body. And that's what vitamin D does. Now, one powerful way it does this is by literally regulating the expression of our DNA. Yes, vitamin D has been shown to turn on and turn off hundreds. I think they've measured at least 300 different genes in our body. So, for example, they found that it can turn off genes that promote the growth and development of cancer cells and turn on genes that suppress cancer cell growth. Our genetic code contains millions of instructions for how each cell should operate, and vitamin D plays a critical role in regulating which genes get turned on and which genes get turned off. Our cells rely on vitamin D as a critical signal for regulating this genetic expression. If levels are too low, genes that should stay turned off come to life, and genes that should be shut down and suppressed mostly get turned on or get turned off. So it's very complex, and we found in studying autoimmune disease that vitamin D has these cells that really affect that affect autoimmune disease. T cells, the cells that B cells that generate the antibodies that actually attack things like the joint space in rheumatoid arthritis, or the myelin sheath in multiple sclerosis, or the lining of the digestive tract in Crohn's disease. These cells actually have receptors for vitamin D, and when they study this, they find that when the vitamin D levels in the blood goes up, it has this regulatory effect on these cells that helps to not shut down their activity and not suppress them so that they can't create an antibody response to, let's say, a cold virus or a flu virus or a bacterial infection, but it down regulates their activity from producing more antibodies to our own body. So this amazing regulatory effect, it's really pretty interesting. So how can such a simple vitamin, I mean, what other vitamins are you hearing about that are literally regulating our genetic expression? How can such a simple vitamin play such an important role in the expression of our genetic code? It seems like a big responsibility for just some vitamin that you get from milk. Well, as it turns out, vitamin D isn't just a vitamin. Vitamin D is actually a hormone. It was misnamed as a vitamin because it was first discovered in food before researchers and scientists realized that the vast majority of vitamin D in a human body is made by our skin in response to the ultraviolet rays of the sun. Only a tiny fraction of circulating vitamin D is meant to come from the diet. The vast majority needed to regulate our cellular biology and genetic expression is made in our skin from exposure to ultraviolet light. Now, there are some other vitamins that are manufactured in our body as well. Most vitamins we're completely dependent on getting from food. But even the ones that are manufactured in our own body are only made in very small amounts, and they're actually not produced by our own body like vitamin D, but they're produced by bacteria that live in our GI system. Additionally, every cell in our body has a receptor for vitamin D, which is a classification reserved only for hormones and not for vitamins. So yes, while technically it still could be called a vitamin because we do find it in food, it's actually better classified as a hormone because the vast majority, like I said, of vitamin D that's circulating in our body comes from production in our skin from exposure to sun. Our body has this own internal mechanism of making vitamin D, just like it has our own internal mechanism of making every other hormone, like thyroid hormone in our thyroid gland, or testosterone in the testes, or estrogen in the ovaries, or insulin in the pancreas. Any other hormone that you want to talk about, our body has a glandular source or a part of our body that can manufacture it. And in this case, the gland is our skin. Now, another critical example of how vitamin D's immune suppressive and regulating effect on our immune system can be beneficial is related to how we started this whole podcast in the first place, which is viral infections like the flu. Now, the most dangerous and common complication of these respiratory viruses like the flu is pneumonia and respiratory problems. So most people that end up hospitalized or dying as a result of the flu, it's usually due to a complication associated with the lungs. Most flu-related deaths are due to these complications, and it's well understood by doctors and researchers that the damage in the lungs associated with these serious viral infections that lead to all these problems is in fact not a result of the virus directly. It's a result of our immune system reacting to the virus and the virus stimulating this extreme immune response that the body cannot shut down or regulate. It almost becomes like an autoimmune-like reaction. You know, the virus is replicating in the cells of the lung. The immune system is trying to shut down that viral replication, but the response of the immune system and the inflammation that the immune system causes in response to the viral replication is actually the thing that is destroying and causing the damage to the lung tissue. So it's the inflammation triggered by our immune system that is causing the damage to our lung tissue. Now, vitamin D helps in this situation by slowing down and putting the brakes on the immune response once it no longer is useful and after it transitions into becoming damaging or destructive. Again, it's working to regulate the immune system to prevent this powerful defense mechanism of the body from getting out of control and causing damage. So there's these multitude of effects of how vitamin D helps our body with upper respiratory infections. Number one, according to the study I cited at the beginning of the podcast, it has the ability to actually reduce our risk. And that has something to do probably with its effect on our immune cells and upregulating immune cell activity, better recognition, better antibody production, better response to upper respiratory infection viruses. But even once a virus gets hold of us and starts a deeper, more severe type of infectious process, vitamin D can help prevent some complications by regulating our body's immune response to that virus and making sure that it's strong and efficient, yet not overzealous and damaging. It's a wonderful example of how the body is designed to regulate itself in the most balanced of ways. However, in order to do this, it needs the proper resources, in this case, a hormone made by exposure to sunlight. Our sedentary modern lifestyles spent in cars and office buildings under fluorescent lights and in homes all day and night have led to an epidemic of vitamin D deficiency. And while I encourage everyone to get out in nature more as part of living a healthier life, most people get a huge benefit from a good, balanced vitamin D supplement, especially during the times of year when our sun exposure is diminished. And I recommend semi-annual vitamin D screenings, which are carried out with a simple insurance-covered blood test. We should check them twice a year. Everybody should get them checked sometime in the fall, heading into winter, like October, November time, when the flu season starts kicking up, to make sure that your levels are adequate. And then we check them sometime usually around June, because around that time, if levels have been good, if people have been supplementing all winter, they can take a break from their vitamin D supplements if they spend a lot of time outdoors in the summer, and they can get plenty of vitamin D from sun exposure. So anyway, hopefully you all learned something interesting about vitamin D. I appreciate it. Please comment. If there's any other vitamins you'd like to hear about, send me an email message. Let me know. I'm happy to do another podcast on whatever vitamins you guys are excited about. I'll be picking the next topic, but I'll look forward to hearing from you all. Thanks again. This is Dr. Kevin Passero on the Green Healing Academy site. So thanks for listening.